This is a diagram of an artery, and you can see the blood flowing through, closing off of this artery by this fatty deposits. One person has a heart attack every 34 seconds and a stroke every 45 seconds, and 80% is preventable. Let's see. My name is Dr. Boisey Barnes. I'm a practicing cardiologist in Washington, D.C., where I've practiced for over 40 years. Washington, D.C. is the capital of the world, but it's also the capital of disease. We have two Washingtons, privileged, and then we have the underserved area, and I have offices in both areas, so I see the great contrast of what happens in America. Cardiology was the #1 killer. I saw the greatest need here since Washington, D.C. had the lowest life expectancy in the United States. Being a minority, our incidence of sudden death, heart attacks, and stroke is extremely high. So my challenge was to improve the life expectancy, especially underserved communities. And let's call the patient for the next office visit.
Okay.
An ounce of prevention is worth pounds of cure. So the emphasis is to identify those factors that contribute to a heart attack and stroke. And I talk about the deadly quartet, and that is cigarette smoking, high blood pressure or hypertension, which is a silent killer, high cholesterol, and diabetes. Those are the ones that we deal and try to get them under control to avoid the #1 killer in America, which is a heart attack. So avoiding eating fatty foods, eating more plant origin of foods, eat less animal products and shift to the plant origin of foods. Anything that's grown in the ground is healthy. I've been on a mission. 3 of those 4 are related to food. And the underserved area has what we call food deserts. When I first came here, for 90,000 people, there was not a major food store here. So I've been on a mission. I've been to Congress, the White House, telling them that the problem is you don't have adequate, healthy foods in the areas that need it the most. We've identified the disparities. There's great racial disparities, and things have moved. They move slowly. So we now have more food markets, and there's a greater emphasis on healthy foods. You have to do things beyond the normal 40-hour week when you can save someone's life or prolong their life. And it's a great motivator, and that's what drives me.